10% of all babies born will need some help breathing. And if a trained person assists that baby to breathe, that baby's life can be saved. The mission, the goal of helping babies breathe is to give people the skills and the equipment so that they are able to provide that ventilation assistance.
For one person that knows how to use a bagging mask to ventilate, there's going to be hundreds, if not many thousands of babies that are going to be okay.
This is for the first time in the recent past that certain training modules have been developed that can be used equally by the frontline workers, the doctors, the nurses, and this will help them reduce at least 20% of all neonatal deaths.
This particular initiative is thanks to Dr. Reddy. As a physician, he recognizes unmet needs. He has strong ties to his native region, and he contacted Project Cure to bring trainers here for a series of courses.
Courtesy of District Collector here, Murali. So the Bannu is organized helping babies breath training. So such kind of programs will help us, help our medical officer in day-to-day practice to render the service well in advance towards the poorest of the poor of the district.
And this is the first of its kind in our newly formed Jaishankar district, which has brought many of our providers to the forefront to learn skills to help babies breathe and save many lives of children.
The training is basically the first minute of life, immediately after the delivery of the baby. The first part is what a skilled birth attendant needs to do before the baby is born. The second part is what we call the golden minute. Every baby should be able to breathe on his or her own or have ventilation with bagging mask established by 1 minute of life. And then the third part is what are you going to do after if there is problems happening with the baby.
Here we are using simulation where the rare event of birth asphyxia they can learn how to manage on the mannequins by role plays, by different activities. So there are different modes that are used in these trainings so that they can learn, they can improve their skills, not only the knowledge.
We already have seen big impact in the way that the doctors and some of the nurses are actually doing the bagging mask ventilation. So yes, I think we are going to be able to make a significant difference to improve the outcomes of the babies.
It's the best training in neonatal resuscitation training program, which is more helpful for all the doctors as well as the staff nurses who are working in the government hospitals. It enhances the encouragement and confidence of the doctors as well as staffs, and I feel very happy to attend this training session. And these training sessions, if you conduct all over the country, will be helpful and decreases infant mortality in all the way.
The training session over here is totally different from the usual trainings what we have. Those are all lecture based trainings, whereas here we are having hands-on training where we can do or where we can practice the things which we are actually expected to do in our daily routine.
It just simulates the live birth conditions of the baby, and each person and each individual is given a chance to work on hands on the simulation and then learn as if they perform on a live baby. And each step has been explained very beautifully, very elaboratively, so that every individual learns it to the core.
Coming to the faculty, I really liked it, learning and interacting with them. It was great exchanging many ideas with them. And these things are actually very necessary that will actually lack in the normal educational programs that we normally have in our institutions.
It is really good to see where Dr. Charanjit Reddy Garu from Bannu NGO and the government and the collector and the people are coming together and the healthcare system gets strengthened up.